But right now, we want to get straight to an issue that could impact thousands of Arkansas families. A disagreement over parts of medical insurance coverage could lead to many being out of network at Baptist Health locations. THV 11's Ian Russell joins us with more tonight. Ian?
If you're a patient at Baptist Health, you've likely seen and heard about some potential challenges you may soon face. The hospital system and a medical insurance company are at odds over reimbursement rates. And if a deal isn't reached, that can mean some changes for patients. Really, this entire conversation boils down to cost. Baptist Health argues that due to inflation and rising costs, they need to have higher reimbursement rates. United Healthcare says those prices are simply too high to handle. I reached out to both for a full picture of what's happening. Carol Wade, a spokesperson for Baptist, told me in part, quote, "While Baptist Health continues to improve operational efficiencies and cost management, it is not enough to overcome the growing external cost pressures." She continues, saying they have not reached an agreement with some payers yet, and says, quote, "If an agreement is not reached with a particular payer by the end of the year, patients with that insurance will be without in-network coverage for all Baptist Health locations and providers." A United Healthcare spokesperson told me, quote, "Our goal is to renew our long-standing relationship with Baptist Health to ensure the members we serve have continued uninterrupted access to Baptist hospitals and physicians. Unfortunately, Baptist continues to request double-digit price hikes. We are asking Baptist to work with us." Again, if no deal is reached by the end of the year, patients with that insurance will be out of network.
All right, Ian, you mentioned that end of the year deadline. So do we know if things will actually get to that point?
Yeah, well, look, this could take longer than January. This could only take a week. We really don't have a clear-cut answer on that yet. But Faith, I will give you some context here. Conway Regional went through this process earlier this year at the beginning of July. And just a month later in August, they actually reached a deal with United Healthcare. So, take that with a grain of salt. But others in our area have been able to figure this out in a fairly short time span before. So no guarantees, but, we've got some past history on this as well.
All right, Ian, thank you. Something to keep an eye on. So we appreciate it. Tom?